You're listening to the Men's Health Foundation podcast. I'm David Watson.
And I'm Marcus Boso.
Men's Health Foundation is a nonprofit healthcare provider for all men, specializing in gay men's health here in Los Angeles.
Each episode, we welcome members of our care team to discuss trending topics in medicine and wellness to help you take charge of your health.
Welcome back to the Men's Health Foundation podcast. Today we're joined by two of our community-embedded disease intervention specialists with our Rapid Results service, which is a rapid STI and HIV testing and treatment service we have in West Hollywood and in South LA. Today we're joined by Rick Turpin here and Nestor Kamurigi. Thank you both so much for joining us.
Thank you.
Thank you for having us.
Thank you for having us.
So I think the best place to start would be defining what a community-embedded disease intervention specialist is. How could you sum that up for us? How would you explain that to folks?
A mouthful.
I personally like the term sex detective because it kind of like breaks down a lot of what we do in the most simplest, boiled down way, you know. We basically, when someone tests positive for rectal gonorrhea, syphilis, and HIV, we explain their infections to them, their treatment, and we try to get them to tell us who they've been hooking up with during the time they could have gotten it and given it to other people. And then, you know, we go track down those people and then give them the good news. Like, hey, are you so-and-so? Well, have I got news for you?
Anonymously.
Of course.
Anonymously. Keyword, yes.
Okay.
It's an interesting role because like usually the first question we're asked is like, well, by the person that's infected, they're usually like, well, who gave it to me? And I'm like, well, there's not really a test to test that. Here's the window period that it could have been in. And then the number one question we get when we're notifying people is, well, who gave it to me? I need to know, blah, blah, blah. And it's just one of those awkward, like, I can't tell you, but you wouldn't want me to tell, you know, if this was me notifying for you. So it's just kind of like that balance of making sure that people feel comfortable on both sides.
Right, exactly. There's definitely, it is kind of, you know, a delicate situation at times, right? To figure out how to be respectful to both parties, you know, because at the end of the day, you're just trying to do your job and just inform people and help them be safe, right? So, yeah.
Just to make sure that I have the right understanding, so as part of our rapid clinics that do STI and HIV testing and treatment, when folks come in and get tested, if they have a positive result, what's the next step in that process? Do you then ask them for contact information of people that they may have either contracted this from or may have given this to? How does it come up in the process of getting tested?
So usually after their results come in, depending on if the nursing gets the information or we get the information first, we'll contact folks and just kind of give them their results, connect them to treatment. That's number one, right? Getting stop the spread right there. And then definitely exploring some STI infection because there's a lot of misconception when it comes to STIs. You see these big billboards by other nonprofits that, you know, gonorrhea is deadly, and it's not, you know, it's treatable, but they like to make these dramatic billboards so that you go get tested. So making sure that you explain how it's actually spread, because a lot of people don't know. You take one sex ed class in high school and it's not having to be covered. Like, everything doesn't need to be covered. It's actually differs by the state on what they actually cover in sex ed. So after that, you never take another sex ed class. So you can't really expect them to know these things, but we should, as a society, practice, you know, education in that way because this is a natural thing that everybody does. So informing them about like how it's spread, and then we kind of like linger. We'll either like meet them in person. I tend to have more success getting partner information when I talk to them in person, but we'll definitely put it out there in their over the phone and like connect with them in person when they come in.
Is that up to the person to decide if they're going to provide information as far as other folks? Okay.
Yeah, they don't have to. It's just one of those things that, like, we also partner with tellyourpartner.org as a foundation. And so I do, if they're hesitant or, like, they just kind of give me no response, I usually will just put that out there because at least you now have that knowledge that is out there, that you can do that. Because the only people that can make things weird are us and the person. So as long as they feel comfortable being able to have that conversation, even anonymously, whether it's with us or a third-party service, it's just at least it's out there.
Yeah, I'd like to expand on that too, because It can also just be down to the schools you go to here in Los Angeles about what your sex ed and education is going to look like. I often have to start from square one with just about every patient I see over in the South Central location because, people really don't want to get tested or want to don't even know what's going on with their bodies.
One of the things I wanted to be sure to ask about, we're seeing headlines recently talking about a spike in syphilis cases, seeing an 80% spike in syphilis cases since 2018, the most new infections recorded in the U.S. since 1950. Can you tell us about that, if you've seen, that same impact and that same surge locally here in Los Angeles and, just what you've observed?
I've definitely seen an increase in cases since I've started. Like, there's been a steady rise. I think the hardest part is because, they even in the medical field, they call syphilis a great imitator because some of these things can show up symptoms and then go in their own, and then people often don't like to go to the doctor, and if it clears up on its own, they're like, oh, okay, it's gone. It was a passing thing.
Yeah. What would you say as far as what are you all talking about? When you're talking to your teams and you're talking to other partners in LA County, what are you thinking are some of the causes behind this spike? Why are we seeing more syphilis cases recorded?
I think with the introduction of PrEP in the last 15 years since Truvada and now Descovy, and Truvada being FDA approved, meaning the FDA approval allows women and trans folks to be able to take Truvada as well. And with taking Truvada and Descovy and PrEP, you have to get tested every 3 months. And prior to that, you wouldn't go to the doctor, like Nestor said. You don't, it's kind of a fearful place. The health industry is kind of, especially with insurances and no insurance, and it can be, especially in different areas, there's a lot of fear and stigma behind it because of how, different people are treated and the biases against them. So I think the introduction of PrEP and people getting regularly tested showed that maybe all of this was still there prior. We just weren't testing, and we didn't have that knowledge that we do now. And so now that we have that knowledge, that's how, this position was born for us at our foundation so that we could help stop the spread.
It's interesting talking about cases since 2018. I'm curious to hear your perception of what else has changed recently for folks as far as, their awareness of STIs and their attitudes towards sexual health. Do you feel like in the past couple of years that people are kind of going in a different direction as far as trends, as far as how people come across sexual partners or their attitudes toward that? What have you observed?
I want to say a lot has changed. I mean, in the last 10 years, we didn't have a app that you could just pick up the phone and have sex just right away on demand. People are having sex more often. It's more convenient for people to do so. And, in the dark, people kind of just tend to ignore symptoms, especially the rashes. And I think that, people are having more sex, and because we've never had a good foundation when it comes to sexual education to begin with, it's just kind of created a convenient cocktail of transmission.
Anything you would add to that, Ray?
I think that Gen Z is just very fluid, and I love that. I love that they're just so comfortable with this natural part of our body. But the thing that's missing from that is health education. And it's how you give the information, and it's how you provide that. Because, again, school or the internet. And if you Google anything, oh, I have a tickle in my throat. Well, you have throat cancer and you're going to die. Like, if you Google the wrong thing and the wrong you're going to get so much information, a lot of it inaccurate. They're also getting a lot of their information from TikTok, which is, I don't even use TikTok, but I know it's like less than 30 seconds of information, and you just can't compile all of this in 30 seconds because it's going to come across like that scene in Mean Girls. You will get chlamydia and you will die. Like, that's just how it's going to come across, right? Like, and so I think this fluidity and like the sex aspect, and I think it's just such a cool thing that people are being so free and more accepting and less shameful about these practices. There's just the educational aspect of like how to protect themselves and have safer sex, because it's not about abstinence like it was when I was growing up. I went to a Catholic school, and that's how we were told, like, don't have sex until you're married. It's only for procreating. And that's what it was. And that was like the view that I had to unlearn as I grew up. And condoms have become one of those things that are in the back of our mind. We can talk about how to like make it more in front of our mind, but that's not the way people have sex anymore. Or, a lot of people, because of the introduction of PrEP and like not having that as a forefront of fear in their mind, because an STI is treatable, but we want to make sure that people know that, And so we want to meet them where they're at. How can we help them have safer sex for the type of sex that they're having?
Right. When you guys are making your calls to people and contacting people and letting them know about their diagnosis or things like that, is there room for education during the actual initial call? How do you guys approach that?
Well, after the initial, who gave me this number? How do you know me? It comes, for me, it's easier to transition to it when it comes to trying to find them care. So it's like, hey, where are you going to get your care? Like, I can schedule with us, or help you with your providers. Do you have any questions? I try to open up to them, and after I kind of just reassure them that there's no way I'm going to give them their partner's information. They want to know more specific details about it. How did I get it is the second question usually, and then from there it's a great way to segue into the explanations of just every possible way you can get, especially syphilis. There's just different stages and different ways to go about it. So it's kind of finding that kind of in during their initial outbursts, because people get scared.
I can imagine the average person who receives this type of call, who doesn't know a lot about STIs, can have a lot of questions, and then maybe with those questions comes a built-in sense of denial in a way, I was safe, how could I get this? Do you feel the same way about educating during calls, Rick?
Yeah, I think it's really important, because while people might have a lot of questions, the trick is the questions that they're not asking, or the questions that they're ashamed to ask, or because they have their own stigma and biases that they placed upon themselves. Growing up in a Catholic school and receiving that type of education, I had to unlearn that as I became an adult. And all of these folks are kind of on their own path of learning what was right for them, but we don't know what conversations they've had their entire lives about sex, that what got them to that place of fear of asking the question. So there's a pretty standard thing that Nestor and I will do when we're staying. We'll just kind of talk about it naturally, it's spread through bodily fluid. Usually that embarks a eye-opening experience for them. What does that mean? Or what do you mean I can have it? Because a lot of the times they'll test positive in an area where they're not having penetrative sex. And they'll usually be, well, I don't bottom, or I don't have sex there, or I don't go there, or whatever. And there's an own bias against that themselves.
Right.
And so that's why it's more of a calming of you actually don't have to have penetrative sex there. It's actually spread through bodily fluid. So that's why we encourage the rectal swab everywhere that you go. It's not about just the types of sex you're having. It's about making sure that all of your areas are protected. So.
And I remember, I think, an interesting point about that. We were talking before we started recording, and Rick and I remember you mentioning that it doesn't take much to come into contact, with, I guess, an orifice, or just to get into the body somehow. It doesn't have to go very deep in order to end up testing positive.
No, not at all. All it has to do is crack that surface,
Right.
Yeah. One of the things I think might be worthwhile to get out of the way is just some general information about STIs to folks listening who might have some questions, who might not be as familiar as some of our other listeners. First thing I wanted to get out of the way is there any STI that would go away on its own?
All their symptoms will go away on their own, but you'll still have an active infection unless you've been treated.
Sure. So if anybody's experiencing symptoms or think they may be at risk, it seems like there's no reason not to go in and get tested. It's always going to be in their best interest.
Yeah, usually if you're showing symptoms mentally, you would go to the doctor, but there's a lot of people that see that, but then it's gone the next day and they think, oh, maybe I just had an allergic reaction or a UTI or all these other things that it could be.
Sure.
But then they're living with an active infection of an STI.
Sure.
So it's just always good to go get tested.
And then I think it's interesting to just bring up for folks the difference between some of these main STIs that come up most often, just so they're aware as far as how symptoms might look different or how risks might look different between them. Can we just quickly go over that?
So things like syphilis, right? Yeah, the primary stages where it looks like a cut in the penis, vagina, anus, mouth. Doesn't hurt, doesn't itch, and most people think that they cut the inside of the mouth eating something somehow. And then, without treatment, that symptom can go away on its own. From there, it can move on to secondary, which is the rashes, which can be transmitted through skin-to-skin contact, so it doesn't always get protected by condoms, which is, I feel like, even though primary is a more transmissible one, I think that it gets around more through the rash, because that's something that people just don't think about at all. But that, again, doesn't hurt, doesn't itch, and that symptom can go away on its own. Mm-hmm. From there, it can lead to further complications like neurosyphilis, like getting to the brain, affecting your ability to think and sense of self, as well as like ocular syphilis, the ability to see, as well as alopecia. The good thing is syphilis is completely curable, so you can get all these things treated. The only thing about it is from the last update we got from ocular syphilis, whatever you lost when you got ocular syphilis, you lost, you ain't getting it back. That's just what's going to happen during that stage of syphilis.
Sure. All the more reason to get tested.
Mm-hmm. Neuro and ocular take years of not being treated to get there, which is important. So not to make it scary, but it is scary because syphilis, a long time ago was deadly, and it's, if you look up like a lot of random old people, like you can see that they just died of, dysentery or syphilis or like all these like random things that like we don't really think about now. And now syphilis is a treatable STI, which is great. Right. And then you have gonorrhea and chlamydia, which can affect, the urine, so the penis, the vagina, the anus, and then orally. You can get it in other places. We just don't test for that at our facilities. But yeah, burning, discharge. What else?
Yeah. Discharge. Oh, I just wanted to add a fun fact that Al Capone, Scarface, died of syphilis.
Oh, there you go.
Oh,
fun fact.
Yeah. And now there's cool, doxypep has been kind of a big introduction into this. And I get a lot of questions about like, oh, well, am I going to become resistant to it if I'm taking doxypep or whatnot? And the county provided us a kind of training just like on doxycycline as a thing. And I just learned that it had been around for so long. And in our history of having doxycycline, there's only been one shortage, and it was due to a mining accident that prevented us from getting doxy. And I thought that was just a really interesting fun fact, just because it has been around for so long. And then with penicillin being something that was introduced later, but as we've seen over the last few years, there's been quite a few shortages of penicillin where like they revert back to doxycycline as the treatment for syphilis. Doxy also treats chlamydia, but doxypep is really cool. It's you take 2 pills within 24 hours to 72 hours of exposure, so sexual contact, all types of sexual contact, because that looks different for everybody. And it helps prevent contracting chlamydia and syphilis primarily, and then there has been some studies where it has been effective with gonorrhea as well, but doxy hasn't been a treatment of gonorrhea in a long time. So it's not necessarily the primary focus. It's more the chlamydia and syphilis, which are very, very prevalent in all communities. Chlamydia is still, I think, the #1 STI that is going around in that sense. So it's a really good preventative just to have on file. And, honestly, sometimes in my encounters, I'll give it to my partner as well when I've had it, so that way it's just a fun little thing that we're doing together, even if it's an anonymous hookup or whatnot. But that way it prevents everything, in that sense, or at least you're just a little safer.
Yeah, I love that. I love that you mentioned, just showing care for the person that you're sharing the encounter with, and it's not just like, all right, you're there to please me, and then we're never going to see each other again until someone else calls you and says, hey, you might have had contact with this person, so you might have this STI,
Yeah, it should just be an open door of communication. Like, why make it weird? Like, this is out there. We know if I'm doing this with you, you're probably doing it with someone else, and that's fine, as it should be, but let's just, prevent the spread.
Right, exactly. I think going back to the education point, like just being open and being vulnerable, with people and being honest, I think is a very, a really good thing to do, in helping to stop the spread.
Yeah. I think all of this hopefully is nice to hear for folks who might be in a position that they feel this, that they're in a situation that maybe they have some news to share with folks, or they're concerned about how they're going to bring this up. Do you have any advice for folks that might be looking to do that themselves, who don't have someone like a STIs to turn to if they feel like they need to talk to their partner or partners about maybe having come into contact with an STI?
Yeah, I mean, I think going to get tested and being able, also like talking to their partner about going and getting tested together, I think is always a really, big thing, just because that way you're both, if you do have it, you're all in the same time, frame of refraining from sexual activity because of treatment. But also, like, there should be a shared space of safety to be able to talk to your partner. And that's another thing that, like, I've done, like, with patients who are diagnosed. And, I'll ask, like, if they have support or, somebody to talk to, or if they want me to help them, or, like, give them words or, like, phrases that they could say to their partner, so that it's a safe space for both of them to be able to talk to each other.
Any examples you could give of some of those, like, phrases? I'm just curious.
Yeah, I'm curious too.
It's treatable. There's medication for it. It just depends on what they were diagnosed with.
Sure.
In that sense, but it's more about just making them feel comfortable. Like, I usually pass my card along. If they want to, maybe they miss something, they can contact me and I'll talk to the partner, with their consent, not necessarily about the other person, but about the infection. I do STI. People call for nursing line to get STI information on our line all day long, and they'll just patch it to us. And we provide natural STI information just for people that even aren't our patients, but maybe they'll become them. So.
Oh, that's great.
Yeah, that's good to know.
Yeah. What advice do you tend to share for folks, Nestor?
One of the things I get a lot is, the people like, why me, or how this happened, or X, Y, and Z, right? So I try to assure people, like, the reality is that often people who are transmitting, like, STIs don't even know they have them themselves. And so it's not always, like, just this malicious intent of someone going, oh, I'm about to go get someone gonorrhea or HIV. Like, often they're themselves haven't ever been tested, or, like, going out there and having fun, and that's great. But, if you don't know, they don't know, and it's getting passed around, which is why it's also helps informing the partner too. It's like, they may not know, and it might not just be you. It could be a bunch of other people, because they might not know.
Good point. I guess in that sense, they're not alone. That's for sure. That's a given.
Yeah.
Yeah. I'm curious, how did you all both get into this career, to this sort of position that you're in right now? It seems like such a unique thing to be in a position to do. And what drew you to this sort of experience?
Oh, for me, I was born HIV positive, so I usually go by lifetime survivors. And I grew up in the neighborhood in which South Central, where the clinic is located. And so there, it's a predominant neighborhood full of sex work, and I just grew up in the hood, in the ghetto. And I grew up understanding firsthand the lack of information and resources for people with HIV, and just not to mention, like, the greater realm of STIs. I mean, you really only have, like, maybe Planned Parenthood, and that's end of list. And they're not a primary provider. And then from there, after years of therapy of having to deal with the whole, being positive and all that, I got into testing people for HIV, and then case management, and I've always, advocacy and activism and all that. And I've always wanted to be that person that I didn't have, like, when I found out that I was positive, or when I was getting sick, or, like, just didn't have that understanding. And, like, especially doing it with Mental Health Foundation, because I'll often run into people who, like, I went to high school with, and so it's really special to me. It's really, like, close to my heart to be able to, like, try to help prevent new transmissions, especially with, like, congenital transmissions of HIV or syphilis. It's just it's a fight that's really close to my heart.
Oh, that's beautiful.
I love that.
Yeah. Thank you. Thanks for what you're doing for both of you. It seems like it's a tough job. Does it feel like a hard job to do, or do you feel like you sort of adjust and get used to it? Is it gratifying?
I think there's times when it can be a little challenging. I really feel like it's more fulfilling because you get a lot of light bulb moments with, folks when you're educating them on this stuff. And when you see it kind of click, or you realize like that they realize that they're not alone, or that they're not weird, or they're not, they're not doing things that are wrong, or like Nestor had said, the why me, you're able to help them. I think that's a really fulfilling thing. And I think that's what the community part of our, position is really is the connecting to the communities that we serve, and I think that that's just really important, to be able to connect to somebody and just help them not feel judged. It's a safe environment to talk and learn about this stuff, because you might have only learned about it once in your life.
Right. I can totally relate to what you both said about feeling judged, if someone feels judged. I think it helps reassure patients if they know, or they can tell that the person speaking to them has been there, and has their back and is from their community, I think that helps people feel more at ease and less like they're being like lectured to, because speaking from personal experience, I have felt that in the past too, when I've gotten tested and things like that. So I think it's great that you guys have you both have like a communal approach to it.
I wanted to add, like, there is some parts, well, on my own personal experience, it can be a little bit emotionally draining in the sense that when you have to tell people, like, when they're newly diagnosed with HIV, especially if they don't have the information, it's just all tears and just like, I am going to die because I don't know anything about HIV. And outside of, like, especially older people, like outside of my experiences in the 90s, I know nothing of this, and now I'm here. And so, you have to bring them from tears to understanding that, okay, this is treatable and I'm going to be okay. And then sometimes it's hard also to just, it's happened a few times where you like call someone and you tell them they were exposed to HIV, and then like, well, I've only ever been with my partner, and then you're just like, well, I don't know what to tell you about that, man. Like, I just need you to get tested. I can't like be your therapist in that one. Like, I'm sorry, and people get mad, and I want to shoot the messenger, but what can we do about that?
Sure. Sometimes taking that brunt allows them, because that's just where they're at in that moment. And I think at the end of the day for us, like, we get that, but we take a deep breath and we just kind of get them what they need, in that moment for the now. Because that's kind of all we can do within our position, is just make sure that they have the knowledge, have the information, and that we get them tested or treated. And sometimes it does come with kind of a snack of defensive or that awkwardness, but it's not the norm, which is nice. But it can be draining when somebody does that. But at the same time, I picture myself in their shoes, in the sense, okay, like, they just got diagnosed, they're feeling a certain type of way, and they're reacting the only way that they know how. And that's how I kind of not take it personally, or let myself, react in that moment back. I just kind of take it and just let it kind of roll off, and just, it doesn't prevent me from helping them afterwards, and Nestor as well.
Yeah. That's great. I mean, it's really tough, to think about how to be a good messenger, and just focus on doing your job and dealing with the emotional load that comes with that. So I just commend you both. I mean, it's
absolutely. Yeah. I mean, it seems like it's absolutely in so many ways, I feel like you all are so much at the front line of people's experience to becoming more empowered with sexual health and with, a relationship to their own health in general. I'd be curious, is there anything you can share as far as any experiences you've had, without mentioning anything too specific about the person, where you've seen that this kind of experience has really made a big difference in someone's life?
In general, I've seen folks who've like been diagnosed with syphilis, and like they'll come back and they'll pull up their little note tab that I've told them to kind of keep, so that they can keep track of their titers, which is how we monitor the syphilis infection. And they have this like sense of pride that they're like taking it down and taking ownership of their infection and like monitoring. And I just love like those kind of moments, and you can feel it. Or when they come back and they're like, hey, I don't need to talk to you today. Because, like going out in the community as well, I often get, either they'll look at me and then look away, or they'll like come up and say, oh my gosh, thank you so much. Like, I really appreciate what you do. And, you know, to protect anonymity, I kind of let them recognize me before I can recognize them. But I don't know. It's just, I love the sense of community that comes from it. It's not necessarily like, you know, we're changing their lives in that sense, but we're allowing them to go back out into the world a little less judged than they were before.
Ooh, that's powerful.
Yeah, you're like empowering them, literally, you know, to go out and spread their knowledge that they've learned from you.
But not STIs.
And not STIs. Yeah, spread knowledge, but not STIs, people out there.
Yeah.
What are you thinking, Nestor?
I want to say I've had a lot of cases in the last 2 years and even this month. But if I want to say one that was really empowering for me or just special to me, was like out of one I was working with, the patient was diagnosed with, you know, multiple STIs, and they had told me they engaged in sex work, but they were just so sad and like upset about, like, not like, they just really felt really ashamed about telling me that. And you know, I just felt like, you know, relax, work is work. Everybody sells a different part of their body, and like we just really had like a good conversation about like sexuality and being free and do what you want with your time, money, and body. And you know, we moved from this whole like, oh, I'm a sex worker, to yes, I'm getting it and getting a lot for it.
The rent is expensive in LA, so
I'm gonna go on Feet Finder soon enough if these rent prices keep going higher.
I keep telling my cats that they're gonna go on OnlyPause one of these days. OnlyPause. I don't know, but I don't copyright it. Please, somebody do it. So
I hadn't asked you yet, Rick. What got you into this experience yourself? What's your backstory?
So, you know, throughout my like career in life, I've been I taught kindergarten, and then I wanted to do more, and then I was a crisis counselor for another nonprofit that served the LGBT youth in, you know, kind of traumatic scenarios, and they would call in and you'd kind of counsel them and help them and just kind of be that friend. And that was during COVID, so that was a little taxing mentally for a little while, and it led me to want to go back to work in person and kind of be hands-on with the community. And, you know, I just remember scrolling, I think it was Indeed, and I saw this job description, and I kind of felt like I had never heard of anything that was quite like this before, because it certainly didn't exist when I was in my 20s and like going through my own exploration of life. And I wish that I had somebody that I could ask about STIs or actually having education for. And so I was really interested, and I applied, and it started, and here I am. It's almost been 3 years of doing this, and I really love it. It's inspired kind of my own growth and journey of like where I want to see it grow and go. And, you know, it started out as just like 2 of us in South LA, and now we're about to grow to grab more and help more people. And, you know, nobody gets left behind kind of thing. It's really cool to see and watch it kind of just get bigger and bigger as we go. And it's in relation to the work that, you know, we've done ourselves. And so, you know, our manager is just like such a supportive person, and he did this work prior for another organization, and that was how it kind of came to be here. And so we've kind of taken this little like baby that he had, and it's just kind of grown into like a bigger thing, and it's just really cool. It's a supportive environment, and I think that that's an attest to like what we have to do. So it's really nice that we get that on the back end as well.
That's great to hear. I mean, it sounds like more to come from Men's Health Foundation in the public health front.
Yeah, I would. Yeah. I think that's what we're all planning for. Yeah, absolutely. Yeah. I'm curious when it comes to the past couple of years. You know, I wanted to bring up Mpox and the Mpox outbreak, just to check in on that. Is that something that you're still? Is that still coming up in your work, and is that still something that people are experiencing?
I haven't seen as many cases, especially not from when there was like the big outbreak, but we still are providing the vaccine, and we still are ordering it. It's not coming back as influx, because I think the difference between like how we rallied around COVID versus we rallied around Mpox was it was pretty aggressive in like, let's fight this, let's get you vaccinated. And I know we at MHF were very, very, very like prevalent in getting people vaccinated. And it was really cool to see just like the amounts of people that were like in, and we were getting them vaccinated and preventing this. So it was just really cool to like see what the front lines really looked like in that sense. And so I haven't seen it as much, but we still are offering it. And every now and then we'll get, you know, the vaccine for somebody or somebody who needs their second dose or some stuff like that.
Mm-hmm. Mm-hmm.
I want to say it was a bit of a beautiful moment to see everyone in public health go, "Oh no, you don't."
Right.
One of the things I wanted to ask about, I think it's so interesting, you know, Rick, you working in West Hollywood and Nestor, you working in South LA, just to hear about those neighborhoods, which I think have so many unique qualities to them compared to just about anywhere else in the country, as far as it relates to just the specific challenges in those communities, and maybe some of the things that, you know, I think about with West Hollywood. I think of it as like a very, I perceive it to be a very sex positive community, but I'm not sure if that's the full story. But I would love to hear your insights on what it's like to be serving these communities and just what you've noticed as far as some of the specific challenges there.
You know, one of the things that I love about working in WeHo is a community. Yes, it's very sex positive, but there's a lot of people that still don't have sex education. And when I do provide them how an STI is spread, that is a light bulb moment for people who have a lot of sex and they're open about it, but they might not know the other things, which is part of the safer sex, you know, just that knowledge of how it's spread. But I think, to be honest, like, I love that aspect. But one of the things that I love more about it is we are open on Saturdays, and I personally work on Saturdays. And I work the front desk a lot of the time, and it's because I want to connect with the people that come in. And a lot of the times on Saturdays, clinics all over LA are not open. Even our South LA branch is not open. So WeHo will get people from South LA. We'll get people from the Valley. We get people that drive from Riverside because they're going to a quote unquote gayborhood because it's a place where it is a little more sex positive or perceived that way. And they'll come and get tested. We get a lot of people that identify as straight that will come in because same thing. They know they're not going to be judged for what they were doing, you know? And so on Saturdays in particular, we get a lot of people that aren't from our community, but they feel safe coming here because they know we are more sex positive than their areas. And it's such a big market that we get on Saturdays in particular, where they will drive 2 hours to get tested or treated from us, which it's really cool to be able to talk to those people, or even younger folks. Like, I remember like some high school students came in to get tested, and like they just, you know, it's great. It's great that they felt safe enough to come from where they were coming from to get tested here. Taking the bus for 2 hours to get there was just a cool moment to connect with, you know, all types of people. And like, I think that's one of the reasons I also really love working in WeHo is just it's perceived this way, so people flock to it.
Right.
Oh yeah, that's a beautiful thing. Yeah, that's great to hear too. I didn't know that. Yeah.
I didn't know that either. All the way from Riverside, you know.
And I'm sure there's clinics, but judgy, you know,
Right.
like
Sure.
there's stigma everywhere. And like you drive 5 minutes out of LA and it's a whole different world, you know? So it's just, you can provide that space, but you just have to be able to provide it. And so that's why I think people come, which is just fosters that in me to want to continue and spread that.
Love it.
Yeah.
Knowledge, not STIs.
On my end, I love the location. I mean, outside of it being Warren, South Central has its own sex positivity in its own way because, you know, Figueroa has nothing but like the women sex workers, and Broadway has all the boys, but they're a little more down low on that appearance as far as like sex work goes there. And we also have like 3 or 4 homeless shelters that are like within walking distance. So there's a challenge all around because, you know, people who are hiring sex workers and sex workers don't exactly keep track of their johns, but they're pretty good about wearing condoms, so it's like kind of balances it out. And the harder challenge I would say is the homeless population, because homeless people, they don't also keep track of each other's names or actual government names. The most I can probably get out of them is like what tent around what corner are they, or sometimes they're at the shelter nearby, but they mostly just come for gift cards and testing, and then we might not see them again. So it's like a really Like if I don't get a hold of them or if we can't get them treated right away, it's much harder to try to get them to come back later on. Or I usually have to put like alerts on them because if they don't show up, they'll likely come back in 3 months for another gift card. So I can like try to catch them then. Mm-hmm. But I think that's probably the biggest challenge is that people, like we deal with a higher homeless population there. So it's, a bit of a touch and go when it comes to getting people or tracking them down.
Wow. Yeah, that's really impressive that you're doing that regardless. I'm curious, when folks come in, when they get tested, can they get treated on the same day for the most part?
Yes.
Is that usually how it works?
Usually, especially if they have symptoms, if they're symptomatic, they just try to test them right away.
Sure.
Just in case, especially if they're homeless, sometimes we'll just, treat them just because we know that we're probably not going to see them again.
Mm-hmm. Mm-hmm.
Yeah, they get if they show symptoms or they have an exposure or, it's at the end of the day, it's up to the provider, but on what they're going to do. But we treat proactively quite often.
Mm. When you said alert, Nestor, could you explain a little bit more about what that might mean?
So usually when I have, when someone's homeless or like they're just not, we're not able to track them down, on their chart, when someone will try to open it up, it would say an alert, this person needs syphilis treatment. Okay. And then you can go into their chart that way, because that way they, whoever's putting the intake for them can let the provider know, or the provider can see that in their chart and say, okay, well, this person hasn't been treated and needs to be treated.
Got you. Okay, so it's sort of like tagging it so that the information is easily accessed for the next person and passing the information along.
Yes, and
gotcha.
Once they're treated, since I'm keeping track of their case, I can take it off and fall from there to make sure that they're treated.
Cool.
Sure. Is one thing I haven't asked is if this is a process you follow for folks recently diagnosed with HIV as well. Is that something that you all also have a role in as far as like letting other folks know, or is that process different?
In the sense of their partners?
Right.
Yeah, that's something that we do with like a newly diagnosed person. If they provide us their partner information, we'll contact and try to get them in for testing and kind of go over what a window period looks like with that, so that they can close that window from that sexual encounter.
Sure.
So that they can, have that sigh and breath of relief if they're negative, or connect them to care if they are positive, so that they can remain in care.
Sure. Is there ever an opportunity that you've experienced where PEP might be an option? Is that something that comes up?
We do PEP in both of our locations. It's post-exposure medication that you can take within 72 hours of that sexual encounter, where it's believed that HIV could have been contracted. Again, it's up to what the provider sees as an active need for it. But yeah, it is something that we provide for our patients that need it.
Great.
That's great. Yeah.
Great. Do you have any advice for folks that are also, working in public health and are working maybe, in general in the medical field, who are working with people with STIs or risk for STIs? If you could give advice that you think is something that is an overarching top line issue most of the time, what would you recommend to folks as something to look out for, just a way to talk to people, a way to perceive, addressing folks when it comes to STIs and sexual health?
There's something that I heard, and I found out that it was a psychology thing apparently, but I always think about it when I approach patients. It's that I don't care what you know until I know that you care. And so it's like the most important thing I try to get through to people. The patient doesn't care about anything if you don't care about them, and they're not going to be there to hear it either.
Wow.
Something that I've learned along the way is, an expert's mind only has one outcome because they are tried and true that works. A beginner's mind tends to have a toolbox, and they're open-minded to everything. And sometimes when we've been doing things for a long time, we need to kind of check our ego and go back to that beginner's mindset so that we can remember that our first mission is to help the person in front of us.
Wow.
It's real.
Yeah, that is real.
Great.
And
Thank you.
Yeah, I mean, just to respond to that, I think it's just amazing that you guys continue to do this work. And I think, the listeners out there and people who are scared or might have internalized shame or stigma, I think it's really good for them to hear this, and really talk to to actual providers and let them know, like, hey, you know, we're actual people and we'll treat you like a person too.
Yeah. So, guys, I wanted to just check in. Is there anything that we haven't covered in this conversation yet, as far as it relates to, you know, the work that you do? Talking about, you know, the sort of latest situation right now with STIs that you wanted to make sure that we address before we wrap up.
No.
I just want to say that, you know, it's important for people to get tested.
Yeah.
You know, there is, like I said, noted increase in syphilis in cases of congenital syphilis. You know, what does it say? How do they say? Monogamy means different things to different people.
Relationships are very different. There's a great book out there that helped me kind of grow with my own mindset, because you're brought up with monogamy is the way to go, and like that's all. But like as you grow and you learn that might not be what's for you, like when I read The Ethical Slut, like it really helped me just at least put myself in other shoes to kind of understand the type of relationship I might want to have and what others have, and how not to kind of judge that relationship. And that's taken like a long journey to like unlearn, but like everybody has a different type of relationship, and monogamy doesn't mean the same thing that it meant to our grandparents.
Thank you both so much for joining us today. We'd love to talk again sometime soon. I think there's so much to unpack with the work that you do, and we really appreciate it.
Yeah, did we want to shout out one more time, like where people can get tested or how to reach us and things like that?
Sure.
Yeah.
Well, if you want to find me, I'm at 8601 South Broadway in South Central. You're Nestor from the neighborhood.
Nice.
And I'm Rick. We're at 8280 Santa Monica Boulevard, right next to Hamburger Mary's. Can't miss us. You can also make appointments on our website, menshealthfound.org/rapid results. It's a really seamless, easy process. You can do same-day appointments. We do prep follow-ups with insurance, and we do a lot of those things. We can connect you to care. Our primary care office has so many other services. We can do referrals, all that fun stuff. We, you know, have a behavioral health department now, so that's even great. All sorts of things coming out of here. So get tested, know your status. It's yours. Don't spread STIs. Spread knowledge.
Alrighty, amazing.
Perfect.
Thank you so much.
Thank you both.